YouTube. It's Pop on the Not for Kids channel. Um, I've said it before, and I'll say it again. There's no sense in saddling America with $54 trillion more of debt to provide basic health care for individuals when that stuff can be taught in school. If this were like the 1940s, back when people were self-sufficient and had a victory garden and all that other stuff, that would be taught in school, to have a basic safety kit at home with bandages. And I'm not talking about one of those $20 kits that you get at the drugstore that only has a pair of scissors and bandages. I'm talking about a real medical kit which you can make at home by yourself and stock with real medicine and salves and things like that, cheaper than you can for those kits that you buy. All those kits for convenience are just for compliance issues for businesses that have to have a safety kit. They'll run to Office Depot or someplace else and they'll buy one of those $19 kits so that they'll be in compliance with OSHA. I'm talking about real kits with large amounts of bandages, big bandages, and tape and scissors and salves and creams and ointments and all of that stuff. It's not too expensive and you can build it week by week. I work on my kit each week and make sure that whatever's missing is replaced and whatever's out of date gets upgraded. But all that stuff can be taught at school. I had sisters who were candy stripers at the hospital who volunteered and went on to be nurses, and excellent nurses at that. One sister was quite the snob, where she thought she was the only one, and still thinks that she's the only one worthy to help someone, and that she's the only one who's saving the world. But I worked in a nursing home. I worked hard. I studied hard. I was fortunate enough to work for a nursing home that would train students for the CNA, GNA, and I had good scores. And the lady on the floor would not let me on the floor because I had white shoes, but they had a green Nike strip. So she let everybody else on the floor except me, and it backfired on her. For some reason, she got sick for about 3 months, and the nursing home hired me anyway, and they hired me at a higher rate of salary, and they put me under utilities. So I took care of people, and I did laundry and vacuum carpets, and I did whatever they needed to be done. And my snobby sister, I went over to visit. She said I really wasn't much of anything and couldn't have made that much of a contribution and all that. So I said goodbye to them and never went back, because I don't let people diss me and get away with it. And she's snobby and condescending, so there's no reason to go over and try and visit with her and put myself through that. I don't let people disrespect me like that. But be that as it may, there's simply no reason for the simple stuff like cuts and burns and stuff like that to spend all of this money and sink this nation deeper into debt. When I was a kid, I broke my ankle, and my mother took me over to the doctor's house, and the doctor's son, who was 13 or 14 at the time, I think he may have been younger than that, he put my ankle in a cast, and it was perfectly fine. But this country needs to get back to self-sufficiency and self-reliance. and stop chalking up all of these huge bills for everything that we're not going to be able to afford in the future.